Hi, welcome everybody. My name is Bryan Layton. I'm the Assistant County Manager, and I'm here with Janelle, Linn, our Public Health Director, and Catrina, Jenkins, our Emergency Management Manager. Right. Thank you for joining us. We're going to talk about vaccines and do a COVID update. So let's begin by having you guys kind of introduce yourselves and just let everybody know a little bit about you.
So I'm Catrina. Like Bryan said, I'm the Emergency Manager for Navajo County, and I'm here to help talk about some of the logistics and operational stuff.
How long have you been with the county, Kat?
Oh my goodness. It'll be 20 years in May, actually.
Okay, awesome.
I'm excited. I started out as a dispatcher, and then I went into the emergency management world 13 years ago. So
Fantastic, thank you.
Thank you.
Janelle?
My name is Janelle Linn. I'm the Acting Director for Public Health and the Public Health Nursing Supervisor. I'm here today to talk about vaccines and answer some of your questions that we've been receiving vaccine related.
Okay, awesome. And yeah, that was a good point. So if anyone has a question, please put that in the comments. We have somebody watching from Turkey right now, apparently.
Interesting.
Thank you for watching.
So yes, if you have comments, questions, put them in there in the feed and we'll try to get to those. Let's start out though with our daily case numbers. Now, for a while there, we were having dozens of new cases every single day. And here just late in the past week or two, those have kind of stemmed down, relative to what they were. We've had fewer case numbers. So first, Janelle, could you talk to us a little bit about what that was like for your nursing team trying to handle dozens of cases every day? And then kind of what are we seeing here right now? Why are they kind of dropping?
Okay, so we really saw the peak of our spike, our second spike, and our second spike of cases was about twice as high as our first spike. And it peaked for us in December, and once it peaked, it leveled off and stayed there for quite some time. So for the month of December, we worked over 1,100 cases. So there were some days we were getting close to 200 new case reports a day. And so that was really heavy on our nurses. They were working 30, 40 cases a day apiece, some of them. And working a case means you call the person, identify their household contacts, their community contacts, trace out the different exposure points for that whole case. So it's not an easy process, and it's a time-consuming process. So it was a little overwhelming. We started to see those numbers start to come down about the first part of January. But it took some time, and then we went into 75 cases a day, 50 cases a day. We do feel like we are consistently moving towards the bottom of that peak. Now we're averaging around 20 cases a day for the past week. So to us, seeing that is also the trend and pattern across Arizona and with our tribal partners says to us that we believe we have come down. We're on the downside of that spike.
And when we talk about peaks, the first peak that we saw was in summertime, right? Mm-hmm. And so what led to that peak, or what do we think led to that peak?
So just the larger presence of disease in the community and more exposures, and just more people being exposed, you have higher incidence of disease. So that's when we really started our shutdowns were put in place, really pushing our social distancing, mask wearing, all our preventative measures. School went out for the summer, those sorts of things that make people distance more, be outside more, and we see that start to die down. And we consistently stayed low for quite some time. Then school started back up. People think that it's the weather and it's the temperature. It's not. It's that when it's warm, you're outdoors and distancing more, and when it's cold, you're indoors and you're closer contact and more, exposing people more. So once school goes back in, people kind of got COVID fatigue and got tired of wearing their mask and hearing all the messaging, and we started to see lax in behavior, and then that leads to starting to see cases increase. Then we went into the holidays, starting with Halloween, Thanksgiving, Christmas, where people are gathering, and that leads to our big spike.
Okay, thank you. Now, even with case numbers starting to drop here recently, our hospitals are still stretched and they're still stressed, right? Can you tell us a little bit about what you're hearing from our local hospital systems?
So across the state of Arizona, we're hearing over the last few weeks about a 92% average on their bed capacity, meaning that 92% of their beds are full. And we're seeing even higher percentages here locally. We're hearing from Little Colorado and Summit, those are our hospital healthcare partners locally, that they typically have maybe one COVID bed open or one ICU bed open. And so they're still seeing that high acuity level of people being really sick and needing to be hospitalized and needing ICU care, but not necessarily having a bed for them.
And the hospitals get hit because they have shortage on bed space, but then their own staff are probably struggling getting sick, right? And so it's kind of a double strain on them.
At one point in time, Summit shared with us they had 90 employees out isolating, either because they were sick or had been exposed and were isolating. So that puts a big strain. About 30 or 40 of those were nurses. So they put in a surge request. We brought some surge nurses in to help them. Those nurses are still there until March, helping them get through, and that helped them get through that crisis. But yes, it has a big impact on our healthcare system.
And surge nurses are basically traveling nurses that kind of go from place to place.
Yes.
Okay. And the county helps coordinate those surge nurses coming in to our local providers. Okay.
Yeah, the hospitals will reach out to the emergency operations center and ask for personnel, and our liaison that works with our state partners and the other agencies throughout the state will put out a request for people to let them know that we need some help here. And then we fill those orders through that method.
Okay. And Kat, this is kind of a difficult thought, but we've been asked this multiple times online about morgues and mortuaries. So if there's like a really terrible surge in deaths, what happens when mortuaries and morgues can't handle everything?
Right.
What happens in that situation? What preparations have been made?
Yeah, so we have, since the beginning, have been doing what we call mass fatality planning, and it is a sad subject to deal with, and no one wants to think of it in those terms, but because we were not sure how many people were going to die at one time, if this was going to be really bad, we did put some planning into place and actually reached out to our mortuaries throughout the county, and we get daily reports on how full their units are and what that looks like, because that helps us plan better. But we also increased our capacity by bringing in some equipment in the form of some big walk-in coolers. And we have 2 of those in the county that increase our storage capacity if and when they're needed. So we have those capabilities built in to help with that planning. And we're looking at some future planning. So those storage facilities that we brought in are temporary, but I'm going to be looking at potentially some grants to make it more of a permanent thing that we can utilize, because other issues throughout the county might impact our mass fatality plans.
Okay, thank you, Kat. Now, most of the questions that we're seeing right now have to do with just the availability of the COVID vaccine. The last time that we've talked with your team, they explained that there is a national shortage of the vaccine, but we're constantly trying to get more. Do you have any updates on that? What has changed? What hasn't changed?
Not much has changed. So we're still seeing that the manufacturers just cannot crank out enough vaccine to meet the demand. There are different companies coming into play, getting ready to go before the FDA to get their product approved, which could throw more vaccine into the supply. But so far that has not happened. So we still have the 2 mRNA vaccines that we're working with, the Pfizer and Moderna. In our county, we use the Moderna vaccine. It's just easier strategically for us to handle due to storage temperature and size of lots that we receive and things like that. So we know there's a need. We share in the frustration in trying to get a vaccine. We're just continuing to ask for patience and hoping that eventually that supply will increase where we can meet the demand and then move further into opening additional tiers of who's eligible to receive a vaccine.
Okay. And in the information that we get, we try to share as quickly as we can. We share that on the COVID dashboard. And folks can get that by going to the county website, www.navajocountyaz.gov. And then right there on that homepage, there's a link to the COVID dashboard. So as soon as we know something, we put it on that dashboard.
Yep.
So another concern, and I'm sure you guys are hearing this too, that folks are having trouble either registering or the system or finding an appointment.
So
Is this new to you? No.
No.
Okay.
Sadly, it is so hard. It breaks my heart because this is such a frustrating time. Because at the same time, I don't know about you, but it's also heartwarming that there are so many people that do want to take advantage of that vaccine. We understand the frustration on getting registered for an appointment and making that appointment. We're trying as hard as we can to put some things into place to help folks that may not have computers at home or have internet at home or be computer friendly. Sometimes computers are not our friends. We continue to work with partners with our public libraries. We have 3 public libraries on board to help because they have computers and staff willing to help. So Sholo, Pinetop, Lakeside, and Snowflake Taylor libraries. You can go there. You can also go to the Recenter in Pinetop, and all of them have computers and folks willing to help you get that appointment and follow the steps needed. And, we're working on some more options, but I don't want to spill the beans too early until we get that finalized. So hopefully soon.
Okay. And we just had some questions come in, how is there someplace that I can go to schedule an appointment? What helps are available? So could you recap just real quick?
Yeah.
If you don't have a computer at home, what can you do?
If you don't have a computer at home, you can go to the Snowflake Taylor Library, the Pinetop Lakeside Library, or the Sholo Library. You can also go to the Recenter, that's in Pinetop. All 4 of those locations have people during their business hours that can help you get on to a computer, get registered. They can help you set up an email because that system does require an email. It is absolutely necessary. And get you through to that appointment setup. Once they do get to that point, again, like Bryan has said and Janelle has said, because there's not very many vaccines, there's not very many appointments because the folks that have the vaccine are only able to schedule as many appointments as they have vaccine for, right? Did I say that right?
So
Okay.
chances are you may get all the way through the system and then there's no ability to book an appointment. And that's because all of the vaccines that we have an appointment has been booked and that particular dose is spoken for. Some of our facility partners, our healthcare partners, are starting waiting lists that they can call people. Let's say if somebody had an appointment and didn't show up or a cancellation. But those facilities are also being inundated with calls. So if you call them, you may experience not getting through or being on hold for a period of time. And some facilities are not developing wait lists. So it's kind of
it's a struggle. And I would also add, please don't just show up hoping that you'll get in because of a no-show or a cancellation. That puts added stressors on the folks providing the vaccine because there is limited capacity as it is and limited space because we have to do the physical distancing and we have to take precautions. So these vaccines are measured and prepared for and planned for very carefully. So when people just show up thinking that they might happen to get get lucky, it actually causes a lot of headaches for the folks trying to do their best to help. So that's my 2 cents.
So 2-step process. You have to be able to get in and register, but then even if you register, you need to find an appointment. And the problem that we're having here is we just not enough doses, and so there's no appointments. And it's got to be really frustrating for folks to go through and then not see anything available. The other way is that the state has a helpline. Folks can call the county health department here, but some residents have said that they end up having to wait a long time on hold. how many calls are we receiving, do you know, here at the health department?
When we come in each morning and check our voicemail, we're finding hundreds of voicemails left after hours, overnight. Some days we're logging over 1,000 calls received here just at our Shovel Health Department. The state line is saying that they are fielding sometimes over 6,000 calls a day, and that their average wait time can be 3 to 3.5 hours to help someone book an appointment. So this is not just a local problem, it is a nationwide, statewide problem. I wish there was an answer.
So we have the avenues and we have the staff here to help. It's just that we just don't have the vaccines. And if we had more vaccines, it would be a much quicker and easier process, right?
Right.
So we just need to ask everybody to remind themselves to take that deep breath, know that we're working on it, and you know, we get the frustration. We're just as frustrated. Me and Janelle talk almost every day, like we just wish we had more vaccine to help more people. So just remember, we're trying everything we can to get that for you.
So the other question, you know, about the effectiveness of the vaccine, what is there an update, or what do you know about the effectiveness as far as how long is it good for? How long? What do you know? I know this is constantly evolving, and we're learning more and more about it. What do we know?
So it is, and we get new updates and changes all the time. So I'm going to speak specifically to the Moderna vaccine because it's the product that we are disseminating and using in our community. So we got some recent information from CDC last week, some guidance that it's recommended with the Moderna product that it's a 2-dose series 28 days apart. The newest recommendation from the CDC is if you go over that 28-day mark, do not wait more than 6 weeks between dose 1 and dose 2, or it can start to impact your efficacy, which is how effective the vaccine is or how much protection it provides to you. Initially, they were saying that the Moderna vaccine, after the first dose, a few weeks after the first dose, you were starting to see 50 to 54% efficacy. As they've continued to follow this, they're actually starting to see with some people between 70, 80, some even getting up closer to that 90%, building a really strong immune response after that first dose. However, how long is that going to carry you? And it's that second dose, that booster dose, that bumps you all the way up and then keeps you at that level, sustains you there long term. So flu shots, say you get every year because it's going to sustain you through a year. It's still kind of unknown with the COVID vaccines. They're studying that. They're saying that it's going to last you at least a year if you have a complete vaccine series, but they're studying it, and as time shows and they're constantly monitoring, are you still triggering immune responses when they provide tests and things, it may last you as long as 3 to 5 years. So that's going to be information that's constantly evolving, and we receive more and more guidance on.
Very cool. Last question here was about the drive-through clinics. So at the Cardinal Stadium down in the valley, they're doing a very large drive-through clinic. Have we thought about doing something like that here? What would that look like? How would it function? Kat?
Yeah, so yes, as with many of you out there hopefully have seen in the past years, we have flu shot clinics that we drive through, and we use a lot of our fire department, our public safety partners. So there's even one at Summit and one at Blue Ridge School. So we do have plans for those types of pods.
What's a pod?
A pod is a point of dispensing. Sorry,
okay.
I forget my acronym world.
Cool emergency management.
I know.
Okay.
I have so many acronyms.
Okay.
So those points of dispensing or pods, we have 8 of them planned throughout all of the communities in Navajo County. As we have said from the beginning of this show, this episode, we just need more vaccines so that we can open those sites up and have people drive through. So you drive in, you fill out a little paperwork, you pull up, the nurse comes up and you get you your shot, and you go. With these vaccines, we do have a 15-minute observation period, so you do have to wait that 15 minutes after you get your shot, and we have a plan for the parking lot where we're going to have people sit and watch for you, and you're going to honk if something distressing happens and we need to check on you, stuff like that. So yes, we absolutely have plans for pods, and we're looking at, you know, changing those if we need them. We look at alternate sites. So pods are something that we have done in Navajo County. Gosh, 5, 6,
I think we're
set-
actually like 12 or 13 years.
Oh wow, yeah, that's right. So for years and years, that's something we are very confident in, because not every county does that exercise like we do with the flu shots. That's our exercise for this real world incidents. So that's why we do it, and that's why we feel very sure that we're ready for that once we get enough vaccine to open those up.
And that's not just Navajo County that
Right.
does those, right? Talk about the partnerships that are.
So
surrounding
yeah, we couldn't do it without the partnerships, because as much as I love Janelle, I don't want to kill her by working her 24/7, and she's already working way too hard. Her and her nurses are busy again, still doing contact tracing and all of that. So we would actually rely on some of the healthcare providers, Summit, Little Colorado Medical Center. Oh gosh, there's like 15 providers throughout Navajo County that have offered to come and assist, including pharmacies like Hall's Pharmacy and things like that. And then we have our public safety partners. We have the fire departments that offer not only their facilities and locations, but staff and ambulances when needed. We have the law enforcement partners, you know, Shola PD, Winslow PD, Pine Top Lakeside, Snowflake Taylor, Navajo County Sheriff's Office, Winslow PD, Holbrook PD. All of them have been practicing and helping us do those exercises so that they know what we need, because I can't be at all 8 different locations at the same time. And there's only me and 3 other co-workers in my section. So we rely on those partners, and I can't stress the word partner enough. Not to mention all of the wonderful volunteer organizations that help us. We have Sheriff's Auxiliary Volunteers, VIPs, CERT, I'm leaving somebody out. Oh, Senior Patrol, you name it. Like, I know I'm leaving people out, and I feel bad because they are all so very important to this project and this plan. We could not do it without them, without their expertise. So we just appreciate them so much. And gosh, the cities, the towns themselves, because NPC, I can't believe I almost forgot NPC. Yeah, everybody has stepped up to be more than willing to help support the pods and the planning for them, and a bunch of other things. Like NPC has been also using nursing students to help with vaccination efforts, and so yeah, there's a lot.
That's fantastic. It's like the whole community coming together to help.
And that's been our motto for a long time in emergency management. We approach everything in a whole community approach.
United.
Awesome. We had just a question, actually just came through. Someone was asking about a second dose. They got this first dose, but the second dose, they're having trouble scheduling that. Is there any advice, or what could you tell that person?
What we're trying to do is account for second doses by making sure that facilities have second doses to match first doses. So we're really trying to encourage people, go back where you got your first dose to get your second dose. The problem is every facility is handling that a little differently. What we're encouraging is ask them to schedule your second dose when you get your first dose, and that helps ensure that appointment. But if they didn't, try to reach out to the facility where you got your first dose, see how they're doing that, and if they can help you get that appointment.
Fantastic. Kat, Janelle, thank you so much for your time. I know you're both super busy, but appreciate it.
Thank you.
And again, if folks have any questions, feel free to throw them in the comments or reach out to the county directly.
Awesome.
Take care.
Bryan.
Thank you.